right, good morning. We want to welcome you to our press briefing. Certainly thank you for being here and thank our media partners for covering this. I'm Jamie Swift, Corporate Director of Infection Prevention. Um, we want to start out obviously with our update on our cases. As of this morning, within Ballad Health, we currently have 15 patients with coronavirus who's receiving care within our facilities. We continue to have over 300 beds that are available. We have the necessary staff and necessary resources and PPE. We do want to start sharing our recovered numbers. So we get that from Tennessee Department of Health. So on the website as of this morning, there's 164 confirmed coronaviruses in our region within Tennessee. And of those 164, 98 are listed as recovered. So certainly that's great news, and we want to continue to ask our community to continue to social distance. We don't want to let up and see an increase in numbers and spread. So continue to focus on our social distancing. Couple of different things we want to touch on today. So as you may know, yesterday, Governor Lee announced the COVID-19 drive-through testing through our state partners within our region. So any Tennessean who wants a free COVID-19 test will be able to get one starting this week through the Tennessee Department of Health. So Dr. Lisa Piercy, our commissioner, is encouraging every Tennessean who doesn't feel well, even maybe beyond the normal COVID symptoms that we're seeing, that if you want to be tested, you can do so. On Saturday, April 18th, Sunday, April 19th, the National Guard will establish drive-through testing across the state. And that's going to also be done April 25th and 26th, and May 2nd and May 3rd. So that's going to be staffed by Tennessee Department of Health and the National Guard. If you're interested in that within our region, the sites will be Saturday, April 18th, 9 to 3 at Volunteer High School in Churchill, and Sunday, April 19th from 9 to 3 at East Tennessee State University in Johnson City. So be sure and check that out if you're interested. A couple things about masks as you're visiting our facilities. So we continue to want to save our masks for our healthcare providers. Certainly the homemade masks that you all have been so generous to donate, we're saving for our patients who present with respiratory symptoms. So we're asking that as you come in as a visitor that you bring your own mask. As you know, we have visitor restrictions in place. We're not allowing visitors within any of our inpatient hospital units, our long-term care facilities, our EDs, or behavioral health. The only exception is birthing centers, which allows one visitor per room, the NICU at Niswonger, and then any of our rooms that have pediatric patients. Those do allow one visitor, which must be a parent or a guardian. We do make exceptions for hospice and end-of-life care on a case-by-case basis. And so we're asking that if you come in as a visitor, that you please go ahead and bring your own mask so we can certainly keep everyone protected, but save our resources for our staff. That's currently all I have. So I will introduce Alan Levine, our Chairman and CEO of Ballad Health.
Thanks, Jamie. First, I just want to say thank you to Commissioner Piercy and Governor Lee for the innovative approach they're taking to the testing. As you know, one of the things that we've been concerned about from the very beginning is more testing is better, and I think the steps that they're taking greatly expand the opportunity for people to receive that testing, and it certainly takes some of the burden off of us, which is much appreciated. I'm going to limit my comments today to something that we're actually really excited about, and that is the area of research. We have a phenomenal team of physician leaders in this system that are not just devoted to treating patients who present with illness, but in prevention and in using the size and scope of Ballad Health to lend itself to innovations that help improve medicine generally. And as we sit in the midst of this pandemic, there's a lot of discussion about alternatives for treatment. And so we're proud to be able to share with you today that Ballad Health is partnering with the Mayo Clinic to conduct a pretty important and extensive research exercise. And in large part, we're able to do this because A, of our size, and B, because of the relationship that we have with Marsh Regional Blood Center being a part of Ballad Health. And so with that, I am going to introduce Dr. Amit Vashist, who's going to introduce the clinical background of this, and then we'll have a couple of our physician leaders explain this research exercise. Dr. Vashist.
Hey, good morning, everybody. My name is Amit Vashist. I'm a practicing hospitalist, Senior Vice President and Chief Clinical Officer for Ballad Health. I am truly excited on behalf of Ballad Health about this treatment modality that I'm going to talk about. We are really excited about this study. I would like to point out that ever since our inception in the year 2018, we have been committed to providing our communities and the patients that we serve access to the best possible treatment for diseases, including COVID-19. And one such investigational treatment is the use of convalescent plasma. Now, one of the reasons patients with COVID-19 are able to fight off this disease is because their blood is able to produce substances called antibodies, which go and knock this disease off. What we have also seen is that in certain other viral diseases, actually many viral diseases, the use of a product of blood, which is called the plasma, and plasma has the antibodies, takes care of treating patients who are sick with this viral illness. We also believe from preliminary studies and the data coming through that patients who have this COVID-19 viral disease can, if they get antibodies from folks who have recovered from COVID-19, will be able to head this disease off. So truly, this is a very exciting development. I do believe, and our physician team believes, that this could be a potential game changer in our fight against COVID-19. I'm proud that Ballad Health is bringing this treatment modality, this approach, right to our communities in Southwest Virginia, Northeast Tennessee, and beyond. I'm also very proud of the efforts and the collaboration that our administrative team, along with our physician leaders at Ballad Health, have shown towards embracing, moving ahead, and being very nimble about adopting these approaches. I would like to thank our Corporate Emergency Operations Center, our CEO, Alan Levine. When we initially spoke about it, the only question that he asked was, when can we get it started? Our Incident Command Chief, Eric Deaton, Chief Physician Executive, Dr. Ronalds, wonderful team from the Marsh Regional Blood Bank, as well as our co-principal investigators, Drs. Metzger and Dr. Kolbacki. Having said that, I would like to introduce our co-principal investigator, Dr. Evan Kolbacki, who's going to talk a little bit about the technical details about this investigational study. He also serves as the medical director of the Marsh Regional Blood Bank Center. Thank you.
Thank you, Dr. Vashist. I really appreciate the introduction. As he said, my name is Dr. Evan Kolbacki. I'm a pathologist at Highlands Pathology at Holston Valley Medical Center and the director of the Marsh Regional Blood Center. To start off, I'd really like to thank the Ballad leadership, Mr. Levine, Dr. Amit Vashist, and Dr. Chris Metzger for coordinating this very complex effort and navigating these complexities of a study. Just to kind of step back, studies of this magnitude typically takes months to institute. And as Dr. Vashist said, this is a very nimble group that says, hey, let's just get started. And this has happened under their watchful eye and careful direction in a matter of weeks, which I think is very impressive and speaks volumes to the people that we have here in the system and the leadership that we're under. Also, I want to thank Don Campbell and Stephanie Sukol over at Marsh Regional Blood Center for all of their help. As many people know, there's no vaccine and there's no really effective treatment for COVID-19 at this time. And I'm going to reiterate some of the points that Dr. Vashist so eloquently spoke about, but there's many studies in progress at this time. Initial data from one study using convalescent plasma has showed some potential in treating people who have life-threatening disease. Although the data is preliminary, this is one of the only modalities that we have to actually combat COVID-19 at this point. Dr. She's mentioned, plasma is in our blood. It comprises approximately 55% of the blood. It's that amber liquid once you separate the cellular elements out, and one of the components are immunoglobulins or antibodies. These antibodies, typically when you're introduced to a pathogen, will help to combat that pathogen and will give the person typically immunity to if that pathogen is ever reintroduced. So patients that have had COVID-19, we assume that they have all of these antibodies already in place. So we would like to take that plasma from people who have fully recovered and transfuse that into patients with life-threatening COVID-19 infection, with the hope that these antibodies will neutralize some of the virus and help that patient recover. We're going to collect these at Marsh Regional Blood Center, and we'll give some details. But this, in my opinion, this is extremely exciting. This is something that not many other institutions have, even major medical institutions have. We have a great health system, a very large health system, and we have our very own blood bank here so that we can leverage both of those at the same time. And when Ballad was coming together, it was very thoughtful to keep that all in one place. And now we can leverage that not only for the help of our patients, but for research also. So we've also, this study is under the governing, it's a national study under the governing of the Mayo Clinic. And me saying that all of these things have come together, we have all of the parts in place, we're missing one thing. And the biggest thing that we're missing right now is those folks, the plasma or the convalescent plasma from those folks who have recovered from that. And to be honest with you, Marsh Regional Blood Center, we occasionally send out these needs for blood, and they've always been answered. And I'm always humbled to see how many of these folks come in to donate blood anytime we put out a need for blood. And I don't think that this will be any different. I plead with you at this time, if you know anyone who has had COVID, a positive test for COVID, and has recovered, or if you yourself have done that, if you could have them contact Marsh Regional Blood Center to see if they'd be eligible for donation for this possibly game-changing therapy, it would be greatly appreciated. It's not only a one-to-one, one donation isn't only infused in one patient, it's actually infused, we split it into two, possibly three, and it can used to be infused into 2 to 3 patients. So that one solitary selfless event of donation can be multiplied across multiple people, and I would just really appreciate that. And I just really am excited about this. I can see the collaboration between different arms and the research going forward. And with that in mind, I just want to introduce the System Chair for Clinical Research, Dr. Christopher Metzger.
All right, Evan, thank you very, very much. As Evan said, I am the Assistant Chair for Clinical Research. I'm also an interventional cardiologist and vascular doctor. So put simply, a plumber who loves research, and really excited to work together with Evan on this study. This is truly a beautiful collaborative effort, and it really combines Evan and I working together, and everybody working together as a system is what I believe Ballad is about. That we're bringing, instead of a competition, a collaborative, bringing all the strengths forward to combat this coronavirus. So we marry the years of service with the Marsh Blood Bank that Evan is director, and clinical research with all of the administration and workforces that we have. I've had the pleasure of doing research for a long time and been blessed by truly a phenomenal team. They are world-class researchers, but more importantly, world-class people. And we were charged to do the same thing system-wide, and there are other researchers across the system that will take the successes that we've enjoyed with lots of leading, enrolling in publications, but more importantly, bringing cutting-edge technology to the folks of this region first. So this effort is truly the combination of all those. As you mentioned, Evan, that this came across very quickly because a lot of people worked quickly to make it happen. And so the idea is, under one study, with Mayo being the principal folks, but other sites like ours being involved, make an easy, streamlined process so that once we have the donors in place, and we'll get to that in just a second, we can make that technology for people who have recovered from COVID, the antibodies in their blood that help them recover, we hope to offer that to other people in our region so that they can have a cure. And again, remember, there's not a lot of cures or vaccines available, so that if we can offer this with a relatively low risk procedure and help them, that's what this is all about. One of the reasons we've been successful in research and in Ballad, and the same thing as Evan alluded to before, is the people of this region. Okay, when we ask people to give a donation that may help 2 or 3 people, this is a beautiful bunch of folks. So I share Evan's plea that if you have tested positive from COVID and been fortunate enough to recover, then consider the donation that may help 2 or 3 other people not as fortunate as you, who could be very sick, may benefit from this. So in closing, I would just say, you know, I am honored to be not only a part of the Ballad system, my own research team, but the system-wide research in this entire collaborative effort, Marsh Research, administrative leadership, and take this not only in one healthcare, one hospital, but across the healthcare systems, starting at Johnson City Medical Center, Holston Valley, and then spreading it to the rest of the system as possible. So at any time, I know Evan and I are available, Amit and others are available for questions as well. And with that, again, thankfully, I'll turn it back over to our CEO and Chairman, Alan Levine, to ask any questions.
Thanks, Chris. You know, I'm about to make a huge mistake, I know, by doing this, but to put this in layman's terms, when you have an illness like COVID-19 that's a novel virus, what we're seeing is that the bad outcomes are not necessarily the direct result of the virus itself. It's what they call a cytokine storm, where your body's immune system is fighting this virus, and it causes, for respiratory viruses in particular, that's ultimately what causes these issues. That's why we're seeing where people get the virus, they seem to be okay, and then typically in the second week, you start to see the cytokine storm, and that's what causes this horrible outcome for your lungs, because your lungs are basically getting overwhelmed by the body's immune system. And so identifying ways to fight the virus early on through the use of the type of research that's being done, that's ultimately the objective here, so that people can we can use the immune system in a positive way that short circuits that cytokine storm. Did I do okay with that?
That's pretty good. That's
All right. I've been listening, but you know, so I think this is the benefit, I think, of having an integrated system with the collaboration of all these physicians. You know, as Ballad Health is dealing with the day-to-day issues related to COVID-19, we're not taking our eye off the ball when it comes to innovation. In the last 2 weeks, you've seen us roll out the largest expansion of telemedicine in probably history, with the creation of the first ever virtual urgent care, plus all of the 300 plus physicians that are now capable of taking care of their patients through telemedicine. You've seen us announce the region's first ever women's and newborn center in Kingsport. We've announced that we're bringing CT angiography to Greenville. So we're trying to respond to this pandemic while at the same time not taking our eye off the ball of innovation, so that when we emerge from this, we're even better and more capable of meeting the future challenges of the region. As we start pivoting towards what things look like after we get through this first phase of the pandemic, one of the things that I think is phenomenal about this region is it's an amazing place to live. It's an amazing place to raise a family. You can't find a better culture. You can't find a better place to invest and start a business and grow a business. And I know that people are struggling right now, but as we emerge from this, we have a story to tell about this region that we should be telling all over the country. as you look at what's going on in the big cities and the urban areas, you start to say, well, are there better places to live? Are there better places to plant roots and grow a family? And I would argue emphatically, no, I don't think there's a better place for the safety of your family, for the well-being of your family, for investment in growth in your business or investment in growth and new innovative ideas than right here in the Appalachian Highlands, Southwest Virginia, Northeast Tennessee. And over the course of the next week, I think you'll see Ballad Health start leaning in towards pushing that message in partnership with our partners in the business community, because I think that we've got tremendous growth opportunity coming out of this thing if we harness and work together collaboratively as an entire region. And I'm excited about that. With that, I'll be glad to open it up for questions and let some of our physician leaders answer those questions.
First up, we have John Engel with WCYB. John, do you have any questions?
I do, and this may be best for Dr. Metzger as well. Alan, I think you may tag team this, I'm not sure, but I know that, and Dr. Metzger, thanks for being here to take our questions. I know that Dr. Metzger has a national profile and has been an asset to this health system and being able to be a part of some of these things. Can you walk us through the logistics of how this came together? How does Ballad Health get married with Mayo Clinic in this study? What does it look like? How many patients do you need? Those sorts of nuts and bolts aspects of this study.
Sure. First of all, thank you for the very kind words. And I'll say again that I think that the reason that we've been very successful in gaining the prominence or whatever is because of the collaboration of a lot of people mentioned earlier and the people of this region. So towards that, I will be honest, so I'm a cardiovascular researcher. This is COVID-19. This came through Amit and others who learned of this and said, hey, how do we take this forward? Okay. And literally with some of us finding out about this on Wednesday of last week, we're ready to go within a week. That's unheard of with this. Now, Mayo, with this, what the idea was nationally we have to understand that we don't have any treatment options. So we want to hasten the process to make the therapies available that otherwise aren't available while still maintaining scientific rigor and safety to patients. So that's how that came about. So what we did, rather than say we're going to apply for this one at a time with a different process, the idea instead was to say, let's get one process by organizing everybody together, streamlining that process across the system, and then go through what Mayo's already been through, use their smarts in combination with our collaboration to bring this technology forward. So I think that it really is, and then towards your point, when we've done this a lot of times before, and then you bring everybody together and use Mayo's model, you bring all that together, and then we can do this very efficiently. And it is a true testimony to a system, having done research for a long time, to put this together in a week and get it operational, and then just waiting for the sleeves to be rolled up so that we can get some donor, which I'm confident we'll have. It's a testimony to all of us being able to go in with Mayo.
I think, I'm sorry, I shouldn't have touched you. I apologize. You can change your suit later.
Okay.
Let me, Chris is being humble. I think, and all of our physician leaders have been quite humble in this. I can't overstate this. To assemble a study this quickly, and to be able to tag on to the Mayo Clinic IRB and use the work that they've already done to basically create a runway for this is a really big deal. And look, you got folks like Dr. Metzger who have cut their teeth in research in his space for a long time, who's internationally known. People like him are a commodity that organizations like Mayo Clinic, Cleveland Clinic, and others, they'll make a run at all the time. And the reason, and I'm going to put words in your mouth, Chris, but the reason that Chris is here, despite the demand that there is out there for him, is this. He wanted to help create a culture of research within Ballad so that Ballad could help solve. You want us to move it apart, closer together?
Yeah.
Sorry, I'm trying to listen to our folks. We want to create a culture of research at Ballad so that we can help solve some of the problems that emerge in medicine. And in order to do that, when problems emerge, you have to be able to move with agility. You have to be able to identify partners, and you have to be able to execute. And we've got the team that within 2 weeks we went from idea to execution, and now we're ready to roll. And we appreciate the work that the Mayo Clinic's done to set this up nationally, and all of our partners all over the country that are participating in this, I think, have something important to contribute here.
So the reason it was probably me getting closer because he said such nice words. I wanted to get in there closer to those. I hope my mom was listening. But no, I think you're right, Alan. The truth is, and the words you said, you don't have to put them in my mouth, they're true. The reason I stayed here is I believe in what we're doing collectively, and I believe in this region for all the things you said earlier, and the patients who will benefit from this therapy and will also volunteer to do their part to help others. And that's what we're all proud to be a part of.
John, do you have an additional question?
I do, and I know I'm combining like 4 into 1 here, so I'll try to be quick. I'm curious about the funding mechanism, how much money is going into this, where is it coming from? You mentioned that this is a low-risk process for patients. Can you dive a little bit into the risk? Who has the risk? I'm assuming it's not the donor, but is it on the recipient end?
So I may let Evan come up and talk about that, but I want to just say on the cost part and then let you talk about what, I've got an 8th grade education on that, where he's got an MD on it. But in terms of cost, this will be very low cost. When you talk about, this is only plasma per standard of care, 1 unit of plasma, which may offer all these benefits. When you look at somebody's bill for COVID hospitalization, especially if we don't prevent the terrible things that you talked about with the cytokine storm that I learned something about, this cost is a drop in the bucket and is a standard of care. So the cost to the patients and to the hospital system is quite low. Now, Evan, let me turn it over to somebody smarter in terms of the risk of a transfusion.
So the risk of plasma transfusion is the same in COVID, this convalescent plasma, as it would be in regular plasma. Something that we call transfusion-associated circulatory overload, or TACO, is one of them, is where, not to be too detailed, but you get too much fluid in your veins. Another one would be transfusion-related acute lung injury. But these are all risks that people who get plasma transfusions take every time. So I don't think that this is any higher risk than any other plasma transfusion that's really out there. These plasma units will be screened for everything that's screened for every other plasma unit too: HIV, hepatitis C, HBV, and all of the other panels will be performed on this. The only difference is these will contain antibodies to COVID-19, which will hopefully help these patients out quite a bit. And if I could take just one more second and kind of define who we're looking for to be able to donate, if that's okay. So there's basically 3 populations. The first population would be somebody who has a positive COVID-19 test that's documented and is without symptoms for 28 days. They contact March Regional Blood Center, they can come in and they can donate. There's the second population, which have recovered from COVID-19 with a positive test and are between 14 days of no symptoms and 28 days of no symptoms. Those folks can call Marsh Regional Blood Center, and we will arrange, as Dr. Metzger has said, his team is working very hard on arranging all the logistics of this, and we already have it in this nice little format so that it'll be less onerous for a patient to donate. They will have to have a negative test, and we can talk about that more once it comes up with each individual patient. The third population would be those who currently have COVID or have not been recovered for 14 days. Please wait until day 14, and then or you can give us a buzz and say, hey, I'm interested. Could you call me back in 5 days? And then I won't have any symptoms by then, and I'll be more than willing to donate. Either of those 3 situations would be fantastic.
Thank you, John. Next, we have David Floyd with the Johnson City Press. David, do you have any questions?
Hey, I do. Do you guys have a sense of how many other health systems are participating in this study?
Do we know how many other health systems are participating? It's a number of systems.
We'll have to look at that. So,
We'll get you the number, but
yeah, it's a big. Now, a lot of systems, and I talked to other folks going in, Mayo's doing this, and a lot of systems are tiny, and a lot of people are trying to do this on their, on an individual one-off basis, and those are folks who are struggling because every time they have to get a committee together, convene it, and so on. So I think the folks like ours, and I don't know the exact number either, have realized let's tap into the system as a team and streamline it, and that's what the whole effort is about.
David, do you have an additional question?
I do. And are you guys going to be selective about
I didn't understand the
I
question.
didn't either. Can you please repeat your question, David?
Yeah, I can. Are you guys going to be selective about the people that would be receiving this treatment, or will this be kind of widely deployed among all COVID-19 patients in Dallas facilities?
Right.
Well,
Yeah, so are we going to be selective? So the answer is we are always never going to play the role of God, I could tell you that. And we're going to try to make this available as much as possible. The hope is that the blood bank will have a lot of donors and we don't have to even consider, but there are selective criteria. In other words, you have to be hospitalized with the COVID virus, and you have to have respiratory compromise or be very significantly ill. In other words, this isn't somebody who says, I've got COVID, I want the plasma. That's a good question. I'm glad you brought it up. These are for hospitalized patients who are sick from the COVID. Now, where the rationalization may come in is if you had 1 unit available and you have 7 people in there, then you're going to have to, really try to make some tough decisions and then really ask other people to ramp up their donations to help the other 6. But we're going to make every effort to treat everybody who qualifies. But to be clear, it's sick patients hospitalized with COVID who will be offered this therapy.
Thank you, David. Next, we have Fevin Kassoon with WJHL. Fevin, do you have any questions?
Yes. Can you give us an example of the convalescent plasma treatment being used for other diseases, viral infection, and its effectiveness?
This is way outside.
So,
my league.
you can look back, and this isn't a new concept. I mean, it was actually, I think it's over 100 years old. They tried to do it with the Spanish flu. They did it with MERS and SARS and Ebola too. So this isn't an H1N1. This isn't brand new therapy, but it's been used in other diseases where there hasn't been a really good cure therapy or vaccine. Good question.
Fevin, do you have an additional question?
Yes, the main of this is, what do you guys plan to start treating people? Is this immediate?
As soon as we get the plasma.
Thank you, Fevin. Next, we have Richard Lovett with Cumulus. Richard, do you have any questions?
Yes, I do. Good afternoon, gentlemen. What kind of test sample size will you need to determine if this is going to be an effective treatment?
Well, it's a good question. And to be clear, this won't answer that question completely. Okay, it's a one treatment study. In other words, everybody's in it who's going to get this. Now, all the data will be collected in terms of how long people are in the hospital, how long they're in the ventilator, for example, and how many die. But that won't necessarily answer the question: is this the best treatment? Although that's the whole idea of Mayo putting this all together, to gather as much information as possible about, number one, are there many donor reactions, which, as Evan said, probably won't be a lot. And then 2, does it appear to be effective? And what they will probably do, I'm guessing, would be compare that to folks who were not able to get this. It won't be a direct comparison in the scientific rigor, but the idea would be you get some sense. And I think we've already seen anecdotal stories that a lot of you have seen on the national news of people that they really believe that people have recovered beautifully after receiving this. But that's one of the reasons to collect this information. But the other reason for this is to make this therapy available in these tough times without other treatment options.
And I think you had asked about dosage, and the dosage is spelled out in the Mayo Clinic protocol. Everyone that decides that they want this and fits all the criteria will receive 200 milliliters of this convalescent plasma at a prescribed infusion rate. And so typically they look for titers of 1 to 80, but right now there's not really great tests out there for titers. So, and I can get into more details later if there's ever any questions about that. But everyone who does this will receive 200 milliliters.
Richard, do you have an additional question?
Yes, to follow up, as far as recovery of someone who's received this transfusion, would it be the same time frame as you might typically put on someone who was sick initially, say 14 days, give or take?
I think that remains to be determined. And I think it depends on, does this therapy, are they a responder to the antibodies? Does that help? But that's one of we will collect. I don't think we know the answer We're hopeful that it will accelerate the process, but that's why this is being offered and studied.
If I may just add that I think the answer is really in two words, it depends. It depends on how the patient is doing, how critically ill they are, what other chronic medical conditions they may be having. For example, they may be having some underlying kidney disease, underlying bacterial infection, so on and so forth. But it does have the potential to at least take care of the viral part of the illness by the antibodies. So I also wanted to add that as soon as we have the plasma ready from the donors, we do have in our electronic medical records, the order set system, things that we have built into so that as soon as we are ready with the antibodies and the plasma, those can be infused into our sick, critically ill patients. Thank you.
Thank you, Richard. Next, we have Brittany Nade with the Elizabethton Star. Brittany, do you have any questions?
Yes, I do. I was wondering how long antibodies stay in a recovered COVID patient to be able to be used.
So I think this could be answered in two parts. So the recovered plasma that we get from these convalescent donors can be stored for 1 year at frozen. That's one issue that, or one answer to a possible question. The second thing is I'm not really sure we know how long these antibodies last. This is kind of a new illness. We do know that in some animal models, the macaque monkeys, they've injected them with COVID-19, they've recovered, and then they've tried to reinfect them, and they show some sort of immunity to it. But it's so new that I'm not sure that there's a real good answer out there yet. So the fantastic question, and I'm not sure that there really is an answer out there.
Brittany, do you have an additional question?
Yes. So the recovered patients donate plasma. Are they only going to be asked to donate once, or can they donate multiple times?
So another great question. So typically, someone can donate plasma every 28 days. So they can be asked to donate several times. According to the medical director, they can ask to, the folks that collect it can ask if that patient can donate multiple times. And I've already talked to multiple other directors from other blood banks who are doing this right now and kind of got their feel of how this is being done. Some of them are collecting it every 14 days, some of them every 28 days. The one thing that we don't want to do, and we never want to do as blood bankers, we never want to put our donors at risk. So we would take each person on an individual basis and say, is this okay and is this healthy for this particular donor? And we'll look at that on an individual basis because we do not want to put any donor at risk.
Thank you, Brittany. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Yes. I was wondering, I know that Marsh Regional Blood Center has those collections all across the region. Will there be a specific place people go to do this plasma donation, or will there be several spots they can go to?
So at the very good question. At the present time, we're going to collect them at the one in Kingsport because we have the most personnel there, and we're going to train up those personnel in a very rigorous fashion so that we have the exact protocols down, and they're very good at the protocols. And then we intend to widen this out to Bristol and to Johnson City. At this point, we don't have the ability to take this out on our mobiles, but right now we're going to collect it in Kingsport, but we do have plans that as collection is ramped up to move it out to other places to make it more convenient for these donors.
I want to add one part to that, not that I'm speaking for Marsh at all, because they're going to be the blood bank, but remember that as we look for donors, and we're going to, I predict we're going to get a tremendous response. We're going to have a second number available so that Marsh isn't inundated, and we'll make that available through Jamie and others that will do a lot of pre-screening to make it easy. And what we wouldn't want are for 75 well-intentioned people to converge on Marsh without the proper documentation. There's some things we'll have to have, proof of your positive COVID test, screening, and so on. So I don't want to temper it. And you can call Marsh as mentioned. We're going to have a second number. I'm not going to put that out right now because people are watching or on the other line. But we're going to make 2 lines available for folks to screen and have everything ready to go so that it's an efficient process so that Marsh can do their usual fantastic job.
Thank you. Eugenia, do you have another question?
Eugenia, I can't tell you that off the top of my head, but we'll get you the answer to that.
I'll follow back up with you, Gina. Sure. Next we have Jonathan Roberts with the Johnson City Press. Jonathan, do you have any questions?
Yeah, I do. My questions are actually mostly on data that we're seeing statewide and regionally. It appears that we're hitting our peak, or we have hit our peak, things are starting to level off. Is valid data showing the same thing, or is this essentially a false peak?
Well, I'm not an expert on the state data. We're watching very closely what's happening locally. And what we've seen is sort of a flattening of new cases. We're still getting new cases. We believe that the peak for hospitalizations is probably still yet to come. But we certainly believe that we've got the capacity to handle the cases that we're going to get.
Jonathan, do you have an additional question?
Yeah, I guess my follow-up to that would be, do you think that the data that we're seeing at a local level is a sustainable number that, or is it going to be consistent throughout the summer, you think, or what?
Well, a lot of that, I hate to sound like I'm not being decisive here, but that just depends on what occurs. Right now, the flattening that we're seeing has a lot to do with the social distancing and the stay at home and all that. Now, as that changes, what the result of that is clearly remains to be seen. If we loosen up on social distancing, it's possible we can begin to see the spread increase again. And I think that's why the governor's going through such a methodical process to decide how best to reopen the economy. And as he said, he's planning to do it in a phased, methodical way so that we minimize the chance for a massive expansion of the disease. So I think that remains to be seen depending on how they go about with the phased reopening of the economy.
Thank you, Jonathan. Next, we have David McGee with the Bristol Herald Courier. Dave, do you have any questions?
I do. Just one. I was just curious if someone makes a plasma donation, how long is that still viable? How long can you leave that and it still be useful?
So good question. We can actually freeze that up to a year. So if we collected, say, 500 units today, they don't have to be immediately transfused. We can put them in a freezer, and say we see an uptick in the winter, that can be used in the winter. So your donations they just don't have to be immediately used. So that's just fantastic news too. So if we see an uptick, we'll have this in our armamentarium.
Yeah, let me add something to that. Don't go anywhere because you might have to correct me
Okay.
what I'm about to say. The best thing that can happen is we get too many donations of plasma, because even if it's not used for the study, plasma is used all the time for treatment of all types of conditions. And so, is that an accurate statement?
Plasma this one would probably be used. What it would do is we could take the plasma, this COVID-19 plasma from this region, and we could help those out in regions that are more effective too. So Marsh has their ability to ship these out to other regions, New York, California, where we're seeing an uptick in that, where they may not have as many recovered patients. This one would have a specific use for COVID-19, okay. And we could help a lot of other regions too.
So I think the main point there is we can't collect too much. I think that it will go to use.
Dave, do you have another question?
No, that's good. Thank you. I appreciate it.
All right. Thank you all so very much. That concludes today's media briefing.
Thank you.